exciting in the medical world. Dr Sara is here with the health headlines. Good morning, Dr Sara. First of all, just a quarter of parents will let their primary school children have the COVID jab when Britain's vaccine rollout reaches those aged 5 to 11. That's from the Daily Mail this morning. There's so much conflict in information out there. There has been so much conflict, and as a parent, you are naturally worried. So I totally understand this headline, but what do you think about it?
Well, this was based on a poll showing that 33% of parents were still unsure and 30% said they wouldn't. Now, 33% is still a large number of people, so I think it is about education and us having to, make sure that we have quelled any myths out there and to ensure that we're giving people enough information to hopefully resolve any anxieties they have. We know that children and schools are the main areas of spreading. It's a high-risk area. And so far, 500,000 children who are deemed high risk have already been offered the vaccination, and the rollout plans to give it to another 6 million children for that age group.
Well, lots of parents will say, the risk of COVID is very mild in young children. Why would I bother? But there's increasing evidence that points towards long COVID as an issue.
Yeah. So unfortunately, we do know that long COVID does still affect children, and one of the main symptoms of long COVID can be fatigue, and that can be something that can last with children for a long period of time, and it's something that we obviously want to try and avoid. And so the vaccination is one way to try and do that.
It's like you've got to really weigh up the risks and the benefits. They are only young, so you think the benefits outweigh the risks?
Well, I think with everything we know about COVID at the moment, the safety of the vaccine, for me, yes, I would say that the benefits of the vaccinations outweigh the risks of the vaccination.
All right. New technology that allows for daily medications to be used instead of so you can use once a week, once a month, could transform the lives of people with conditions ranging from schizophrenia to opioid addiction.
Yeah, this is a medication that's in trial at the moment. It's currently being trialled for a contraceptive pill in pigs. And hopefully then going on to humans, obviously. But what you do is you swallow this capsule, it dissolves in your stomach, it then allows a branch of these kind of 6 arms to come out, and they then slowly give out the medication, and then it breaks down after 3 weeks in terms of the contraceptive pill, and then exits the body. They're also looking to doing it as a phase 1 trial for methadone, levomethadone, which is for opioid addictions. And the reasons it's so good for that, for example, is that currently, if you have an addiction to opioid and you're on this type of methadone, you have to go every day to have medication under observation. But if you had this, you could just do it every week or every month.
Wow. Next, we've got experts create a breathing cushion which can ease pre-exam anxiety in students. And it's just as good as meditating from the Daily Mail.
I love this one. I'd love to try it because so essentially it's a breathable cushion. So it inflates and deflates as if someone that you're hugging is breathing. It's kind of hot water bottle size. And it's supposed to allow you to kind of slow your breathing rate down and get that comfort that you would do from another living being. And it's found that it reduces anxieties and stress in the same way as meditation.
OK. And also a virtual reality game that hopes, for some clinics will say, that it could help anorexia patients fight their fear of food.
Unfortunately, anorexia has gone up since the pandemic. We know that in children and teenagers, there have been 10,000 cases in the months of April to December last year, which is 2/3 higher than it was pre-pandemic. And currently, we use several techniques, including CBT, so cognitive behavioural therapy, but we do need other forms of therapy to help this, and this has been developed by the Maudsley, which is one of the clinical excellence departments in this area, and it's a virtual reality headset which allows you to immerse yourself into a whole other kind of universe, I suppose you'd say, and the aim is that you can slowly familiarise yourself with foods that give you the anxieties and fears around it, without necessarily having to have them right in front of you, but you get to have that essence of them to slowly get you
How would you get the smell, though? Because it's a virtual reality, so you need the smell of the foods, don't you, to...
I think that's probably part of it, and probably something that you will end up, you know, needing to familiarise yourself with. But to start with, when the anxieties are so high, you probably only want one aspect of it, and perhaps that's just the visual side of things to start with.
Next up, ants could be used to sniff out cancer because they can smell disease like dogs, study suggests in the Daily Mail.
Yeah, so dogs have been used previously to sniff out lung cancer, breast cancer, but this study showed that ants might be able to do similar. They got a petri dish and they trained these ants, and after just a few trials, they were able to detect which are the healthy cells and which are the cells that had, you know, cancers and unhealthy cells. And I think that's really incredible.
It's a specific sort of ant.
Yeah, it's called a black fornica ant, no, Fornica pusca, black ants.
Right.
Fornica pusca, black
so
ants.
don't wander out into your garden and...
Bite me.
Yeah, don't do that.
No, it's a specific type of ant.
Lovely. Thank you very much.